Okay, in this video we're going to study the difference between the nursing caries and the rampart caries, right? We'll discuss the etiology, ecological factors, dentition involved, age of occurrence of these two type of caries, and then specific features, and in the end we'll study the treatment plan, right? Treatment plan. Now first of all, moving toward the nursing caries, what actually nursing caries is. Nursing caries is also known as nursing bottle caries, nursing bottle caries, and bottle mouth caries, right? As the name suggests, bottle in the nursing, so it is the caries that mostly happen in the age that is less than 1 year, right? And mostly in the infants and toddlers. It is mostly in the infants and toddlers, right? Now we'll move towards the nursing caries. But actually nursing caries, it is actually a type or a specific form of a rampart caries, right? It is form of rampart caries. So there is a difference. It is not actually same as the rampart caries. There is a difference. Nursing caries only happens in the primary dentition, while rampart caries, it happens in both permanent and primary dentition, right? Now there comes the dentition involved. Dentition involved. The dentition involved in the nursing caries is only, as we have already studied, that it only happens in the primary dentition. So dentition involved is only the primary teeth. Now what are the commonly affecting teeth? Commonly affecting teeth are incisors, that are the maxillary incisors. Then comes the molars, and then in mandibular is, these are the maxillary tooth are mostly affected, and the mandibular tooth are very less affected as they are protected by saliva and tongue, right? This is the dentition involved. Then comes the etiology. What is etiological factors? Etiology. Keep one thing in mind, that nursing caries and rampart caries both have one and the same etiological factors, that is the low salivary flow, right? And increase intake of sugar or carbohydrate. These are the etiological factors of both. Now, so specifically for the nursing caries, it is the bottle feeding. It is bottle feeding, mostly at night, as the child keep on suckling during night, so it affects. Then comes the breastfeeding. How it affect? It affect as the lactose in breast causes this caries. Then comes the pacifiers that also causes the nursing caries. And the other main factor is medication, that is sugar based medication. These are the etiological factors. This is the basic etiological factor for both the nursing caries and the rampart caries. And to be very specific, for the nursing caries or the bottle mouth caries, there comes the bottle feeding mostly at night, and as a child keep on suckling, right? Then comes the breastfeeding, that there is a prolonged on-demand breastfeeding, that is mostly in less than 1 year of old child, that and the lactulose in the breast causes nursing caries. Then the pacifiers, it might be dipped in some sweeteners or honey, and then the prolonged and frequent intake of sugar-based medication also help causing nursing caries, right? This is the etiology. Now moving towards the other, which is the age of occurrence. Age of occurrence of nursing caries, as the name suggests, it is mostly in the infant and toddlers, right? Then comes the Specific features for the nursing caries. Features. Feature is that it mostly involve the maxillary incisor, that is followed by the molars, and the mandibular teeth are very rare, mandibular dentition is rarely affected, right? And there is a specific pattern is seen in involvement, right? Specific pattern is seen in involvement. Then comes the treatment plan. Treatment plan. For the nursing cares, will always give the oral hygiene instruction in the initial stages, and the preventive measures will ask patient to limit the intake of refined sugars and maintain the oral hygiene. And also in the initial stage, we also give the topical fluoride, right? Topical fluoride. And then will this is all for the nursing caries primary treatment, right? Then directed towards the maintenance of teeth till the transition occurs. This is all for the nursing caries. Nursing caries, it is a form of a rampart caries, but not a rampart caries. The rampart caries occur in both primary and the permanent dentition. The dentition involved in the nursing caries, which is also known as the bottle mouth caries, are the primary teeth. It affects incisors and then molars in the maxilla, and mandibular teeth are very rarely infected, and in fact there is the mandibular canine is most commonly infected if. And although the mandibular teeth are protected by the saliva and tongue. Etiological factors are the low salivary flow and the increased intake of sugars. This is the basic etiology of both. While to be specific, there is a bottle feeding at night, breastfeeding, the lactose in breast causes the nursing caries specifiers that might be dipped in some sweeteners, and the frequent intake of sugar-based medications. Then comes the age of occurrence. It mostly happens in the infants and adults, and the features of the nursing caries is maxillary incisors and the molars, as it is a specific follows a specific pattern. Treatment is the preventive measures, oral hygiene instruction, topical fluoride. This is all for the nursing caries. Then moving towards the rampart caries. Okay, we'll move towards now. Rampart caries. Rampart caries, it's rapidly progressing. It's an acute, rapidly progressing caries. It affect the pulpal involvement in scene, right? Now this is for the rampart caries. Now moving towards the age of occurrence and the dentition involved. Rampart caries, as we have studied earlier, the nursing caries, as the name suggests, nursing, it only happens in infants and adults, while the rampart caries, it mostly happens in infants, adults, and adolescents. It means it include all the ages. The dentition involved is both primary dentition and permanent dentition, right? Then moving toward the etiological factors of the rampart caries. What are the etiological factors? Etiological factors. Same, there is low salivary flow and increase sugar intake, right? And then to be specific, there is a frequent intake of refined carbohydrates, or there is a frequent intake of sugars, late night munching, or poor oral hygiene, frequent snacking that involve the sticky foods like jellies, chocolates, and toffees, right? And there is also the involvement of genetic background, right? This is the ecological factors of the Rampart caries. Then moving toward the specific features. What are the features for the Rampart caries? Feature involved the proximal surface of mandibular incisors, right? In the Rampart caries, mandibular teeth are involved. Mandibular teeth are involved, which are incisors. And to be specific, the proximal surface of incisors are mostly involved. Proximal surface of incisors are involved, and there is a rapid appearance of a new lesion. We can see there is a frequent or rapid appearance of a new lesion. Now here comes the mandible teeth involvement in Rampart caries. Now moving toward the treatment. What are the treatment factors? Treatment, as we have studied earlier, that Rampart caries, it involved the pulp, so treatment will be very symptomatic, as it involved the pulp. It depends upon the level of the pulp exposure. It might have went for pulp capping. There might be pulpectomy, pulpotomy. So it depends upon the conditions or the level of pulp exposure. And these are the specific treatments. And the long-term treatment will depend after the permanent dentition. Permanent dentition is erupted, right? This is all the difference. Now quickly we'll revise the difference in the tabular form. Here I'll quickly revise. There is a nursing caries and Rampart caries. Nursing caries and a Rampart caries. It is a specific type of a Rampart caries. It is acute and rapidly progressive. It involved the primary dentition. Primary dentition involved both primary and permanent dentition. Now etiology is low salivary flow, increase sugar, same as here. Now involve the bottle feeding habits, and the breastfeeding habits, frequent breastfeeding habits, and the pacifiers and the medication that involve sugar. These are the etiology. While the etiology in the Rampart caries is snacks, as involve the permanent dentition, snacks, sugar snacks, genetic background, it's multifactorial in fact, right? Now the treatment depends upon the level of caries. It is oral hygiene, instruction, topical fluoride. While in the Rampart caries, as the pulp is involved, pulpal involvement, so it depends upon the level of pulp exposure. And the dentitions, the tooth involved is the tooth involved are the maxillary, and in this both mandible and the maxillary, mostly mandibular incisor. It happens in the infants and toddlers, while this happens in all ages. This is a tabulated form for the permanent nursing caries and the Rampart caries. Hope you like this video. Do give me your feedback and don't forget to subscribe my channel.